Good morning. This is Maria Brendelmeyer. I'm the Senior Knowledge Management Specialist with Youth Power Learning, and excited to welcome you to our webinar today on a really important topic, and I think a very interesting topic about empowering youth to overcome health and social service workforce shortages, with I think a particular focus on South Africa. So before we get started with the overall topic, just some brief introduction about Youth Power Learning. Youth Power Learning is focused on positive youth development. It's a USAID funded project that can you hear me? Can everybody hear me okay?
Yeah.
All right. Okay, great. Thank you. So Youth Power Learning is a USAID funded project that is focused on positive youth development, and positive youth development has been defined by the program as including giving youth assets and providing them with agency, the ability to contribute, and also supporting an enabling environment that helps them to achieve kind of the best that they can be in their goals. What the Youth Power Learning program particularly focus on is sharing resources, events, information on the Learning Hub, the youthpower.org, which includes also information about lots of projects, implementation projects funded by USAID, but also many other implementers and other kind of positive youth development research that is available. We have identified what works, and so there's a whole section on what works in positive youth development in different areas on the website. There are indicators for how to measure PYD, both kind of on a cross-sectoral basis, but also some specific indicators that have been selected for how to measure youth engagement and other areas of positive youth development. And we've developed a positive youth development learning agenda, which if you're interested about to learn more about it and how to get engaged with it, you can see the agenda on the website, and you can also contact us if you want to have a more in-depth discussion on how you can leverage it. And then last but not least, we have 4 communities of practice: youth and peace and security, gender and PYD, youth engagement, and cross-sectoral skills for youth. And you can join those. We have webinars related to those and other related activities. So we hope that you will partner with us and work with us on some of these activities. So with that, let me hand it over to my colleague, Kristen Brady from Youth Power Action, and she will introduce the speakers and the topic.
Super. Thank you, Maria. Good morning and good afternoon. We're excited to be here today to present the results of USAID Youth Power Action's assessment of opportunities for youth employment in the health workforce sector in South Africa. We had planned to have Olga Merchan here today from the Education Office in USAID to moderate the webinar, but due to the government shutdown, she's unable to be here with us today. My name is Kristen Brady, and I'm the Project Director for Youth Power Action, and I'm filling in as best I can in Olga's place. The assessment was an exciting opportunity for us to explore the intersection of 2 development challenges: the challenge of high levels of youth unemployment at the same time as the country is experiencing a shortage of health and social sector service specialists. So we wanted to see if we could find a win-win opportunity in which youth could fill some of these shortages. The assessment included an in-depth analysis of the health and social services labor market to identify where there might be opportunities for youth and to understand the barriers and challenges to enter this market. The review also included an analysis of the existing supply of youth workforce programs to understand how well this market is being served. We hope this webinar will not only explain unique opportunities in South Africa, but also shed a light on how to address this dual challenge of high youth unemployment combined with shortages of health workforce professionals that we find in many countries today. Before we get started, I wanted to briefly go through our plan for the webinar. The first 15 minutes or so of our webinar will be devoted to understanding the emerging trends and opportunities we found through our analysis. The second segment will be devoted to a review of the existing workforce development programs, both programs that specifically targeted the health workforce and other workforce programs that could be linked to the health and social services sectors. Next, we'll hear from a representative of a program that is the best example we identified that successfully enables marginalized youth to fill an important function in the health workforce. We will then very briefly review our conclusions before opening it up to Q&A. For the first segment, I would like to introduce Obi Diener, who led the assessment team and is a technical advisor working with Youth Power Act.
Thank you, Kristen, and hello, everyone. And before I begin, I would just like to acknowledge Dr. Roy Matherson, who is with us on the line today, a team member who contributed greatly to the analysis I'm about to present, and hopefully will be available for the Q&A session as well. So the snapshot I'm about to present has been informed by key informant interviews with experts in South Africa, as well as our review of available labor market data and secondary sources. So why this health and social services sector? I'm asking this question really from a youth employment perspective. To answer the question, we start really with the overall context for youth employment in South Africa, which really could be described as a grim situation. At the root of the problem, we see a lack of job creation. And in fact, formal non-agricultural employment in South Africa is stagnant and has actually been declining in the most recent quarters on record. At the same time, the youth workforce population is steadily increasing. So the result of these two the result of that is that we find about 2/3 of youth in South Africa are currently unemployed, using the expanded definition of unemployment. And around 1/3 would be considered NEETs, or in other words, not in employment, education, or training. Meanwhile, the Global Entrepreneurship Monitor describes persistently low levels of entrepreneurial activity relative to other participating countries. So within this overall context, health and social services stands out as one of the few bright spots. It is a growth sector that is generating employment opportunities for youth. And health and social services represents 6% of formal non-agricultural employment in South Africa, and the share is growing. So we see drivers of growth in this sector, including population growth, increased income, and of course increased need for health and social services, and driven in part by the burden of HIV and associated health and social problems. Also, in adjacent value chains, such as pharmaceuticals and medical tourism, we see a strong growth trend currently and projected into the future. Another point of special note for this sector is that 75% of the sector workforce is female. And in fact, women make up the majority at all levels, including managers, professionals, technicians, down to clerical support and services and sales. So the bottom line here is that health and social services is an increasingly important source of job opportunities for youth and especially for young women. Here you see a key stakeholders map that emerged from our fieldwork. And mapping the system in this way can help visualize the key stakeholders and the relationships among them in the health workforce system. So even at a quick glance, you'll see a great complexity and diversity of stakeholders. And I'd like to quickly walk you through some of the key features that we saw in the system. So the public sector appears along the left side from top to bottom. And this encompasses, as you'll see, a range of ministries responsible for sectors including education, health, social protection, and even trade and industry. It's a pretty wide mix. Of special note here, fourth box down on the left is the HWCTA, or the Health and Welfare Sector Education and Training Authority. So this plays an important coordinating role within the sector. Some of its major functions with special relevance for this study include, first of all, skills planning and prioritization in coordination with stakeholders in the sector. Second, the accreditation of health and social services, education and training programs. And then third, making investments in education and training, both of youth and of the current workforce in priority fields. We'll return to this later in the presentation. Then the education and training system appears along the top of the diagram, and that is under the oversight of the ministries responsible for education. We find employers right at the center of the map, and that includes, of course, public sector, health and social services, but also private sector, including private sector health services. And in the case of social services, NGOs that are increasingly responsible for service provision and employers. We find youth seeking employment at the top right, and we'll be discussing later some of the both opportunities and challenges for youth. Then of note for our assessment especially was youth employment programs and youth employment program funders. In that same area, you see intermediaries in the system. So these serve to connect the youth with the job opportunities available from employers. And so these would include employment service providers, both public and private, for example. And then finally, we have the category of councils and unions along the bottom. And here I want to especially point out the professional councils box, as these have a particularly powerful role in the South African system. And again, we'll return to this later, but the councils have authority both over accreditation of education and training programs and recognition of professional qualifications. And this is a prerequisite for employment and professional advancement in many health and social services fields. So moving on, I just want to highlight the urgent workforce shortages that, of course, are widely recognized, not just in South Africa, but in many countries as a major concern for meeting global health development goals, such as the UNAIDS goal of placing 90% of people living with HIV on antiretroviral therapy by 2030. Within that same time period, the WHO projects a gap of 18 million health workers globally, and primarily in lower and middle income countries. When we look at South Africa specifically, some of the key concerns here are a stagnant level of public sector employment, coming down to a lack of funded posts primarily. We see relatively high attrition of workers, and especially affecting the higher skill specialist positions who are tending to migrate either to the private sector or internationally. And the result has been severe shortages across several categories of critical health professionals. We also see geographic disparities emerging, both among provinces, as you see in the graphic to the right, which is nursing per population, and then among urban and rural areas as well. So, as I mentioned previously, health overall is health and social services is a growth sector for employment, and we see here that it grew 10% from between 2012 and 2016, according to data from the Health and Welfare CETA. You'll also note that almost entirely the private sector was responsible for that growth in employment. So again, we would attribute that mainly to private sector health and to NGOs in the social service sector. And we see that the private health care job opportunities would tend to skew toward urban and wealthier areas, while workforce shortages are really the norm in rural areas, to speak in general terms. So we found a number of interesting emerging opportunities for young people in the health and social services sector. Here it's important to note that most youth, when asked about careers in health, really wouldn't be able to tell you much beyond doctors and nurses, and this is according to experts we spoke to in the field of career education for youth. Yet there is solid evidence of growth of opportunities in fields that do not require a four-year education. And these include pharmacy, nursing, phlebotomy, child and youth care, just to name a few examples. And evidence comes from South Africa's list of occupations in high demand, among other sources. The graphic you're seeing here also shows that there are funding opportunities available to youth as well as current workers in a number of these growing fields. And these opportunities are provided by the Health and Welfare CETA through investments in learnerships. And just a note on this graphic that NQF, as you see different NQF levels, refers to the National Qualifications Framework. And this provides, at least in principle, a continuous pathway for workers to advance in their qualifications throughout their careers. And this is explored in more depth in our paper. So now I'll speak a little bit about barriers that are specific to the health and welfare, social services sector. And you'll hear more about generalized barriers to youth employment in South Africa, in the subsequent presentation. But the first one, I think the particular note, is the generally high skill requirements and education requirements within the health and social services sectors. And so, in general, as a starting point for employment, or even into many of the education and training pathways that I mentioned in the previous slide in growing fields, the absolute minimum requirement is what's called the matric, for those of you not in South Africa, which refers to a secondary education completion certificate. And as you see in the graphic here, for the 2013 and 14 cohort of youth, only an estimated 40% or a bit less of youth do pass the matric. So we are really, that's putting, I think, in perspective the level of accessibility of this sector. During our field work, one public health care facility manager told us, in fact, that the only people we hire without matric are the cleaners. In addition, when we talk about health specifically, most of these opportunities do require a strong STEM education background, or science and math in particular. And so youth interested in careers in health really should be taking, for example, physical sciences and life sciences courses already in upper secondary school. But few youth may be aware of this requirement. And then a second barrier we find in this sector comes down to regulatory requirements and bottlenecks. And the example you see here is from the nursing sector, which is, again, explored in much greater detail in our report, but to summarize, the accreditation system for education and training of nurses saw a large change in 2015. And as a result of that, a number of the pathways either to enter the sector or to advance from one level to the next within the sector were either closed or restricted. And this is in the context, of course, as I mentioned before, of critical shortages of nurses in South Africa, and also a growing number of job opportunities, at least in the private sector. So as you see in the diagram, for example, there was previously an enrolled nurse qualification that could be achieved through a 2-year diploma. That was eliminated. And another example of
before we move on to Abigail, let me
changes
just
was it
introduce
is no longer
Dr.
possible
Abigail
to
Ornelas
advance
from
to the level of a
University.
registered nurse
Abby is a
through
social
continuing
sciences
education.
researcher, writer,
That's now
and
restricted
postdoctoral
only to
research fellow at
youth with a
Stellenbosch
4-year
University. Abby was
university
our youth
degree.
representative on the team, contributing a youth perspective to all stages of the assessment,
And
including today's
I alluded in the
In addition
stakeholder
to her
map to
considerable
the role
research
of the
skills and
professional
expertise
councils.
on social
And so this is a
services.
case where
Hand it over
the
to
new
you,
accreditation system has been the responsibility of the nursing
Thank you,
council to
Kristen.
implement.
Can everyone hear me
And
okay?
it's been a delayed process in implementing these reforms,
Right.
which has meant that
Okay, great. Thank you. So
it's
good
been
morning
difficult
and
for education
afternoon,
and training
colleagues, and
programs
thank you for
to
taking the
become
time to
certified
participate in
to
this valuable
offer the new
webinar.
set of qualifications.
My presentation will
So
offer
the
you
bottom
some
line for all
insight
of this
into
has
the
been
qualitative and more on-the-ground reflections from our
to
assessment.
really slow,
And this
and in
presentation
some cases,
was put together with the assistance of FHI 360 team member Karen Katz, who is also on this chat. So we're going to look at a review of the youth workforce programs that we assessed during this study. Obi has touched on this in the previous presentation, but just to give you a quick overview of the challenges that South African youth are facing, particularly in terms of employment. Most youth are unable to meet the minimal skill requirements to enter the health and social services sector. So as Obed was saying, in terms of high school subject requirements that are required, and particularly even just matric, which is just completing high school, this is a barrier for many of South Africa's youth. Secondly, we have a lack of connections and exposure to employees and to the world of work, and limited social networks and connections for many of South Africa's youth. The third factor that came up quite a lot for us is that employers demand experience. So even with youth who are sitting on tertiary education and the correct qualifications, they are still struggling to find jobs and permanent employment without the necessary experience. Then we have a lack of career progression opportunities. So for a lot of youth who might be able to enter the health and social services field, they weren't really able to find opportunities to progress further in their career. Job searches were found to be really expensive in terms of transport, printing of CVs, data costs for internet, for job searching and job applications. And in addition, many of the youth indicated a lack of financing for higher education, tertiary education, and also a poor knowledge of available bursaries. On top of these challenges, there were existing and are existing predatory practices and scams, often by employees and job placement firms. And these individuals took advantage of youth vulnerability, their low bargaining power, and their lack of knowledge. And this was often quite disheartening for youth. There's also a significant lack of role models and mentorship, and this can contribute to what was called the Jay-Z phenomenon, which is where youth have unrealistic dreams or understandings of sort of employment fields and what jobs they can apply for, and particularly in terms of the broad scope of employment. But what we found in the study is that the primary challenge was the availability of employment to meet the demand. So as I mentioned earlier, even youth that are sitting on tertiary education are struggling to find jobs. And just to read a quick extract from one of the youth that we interviewed, he says that if you face the facts in South Africa, there are people who are able to further their studies, but even if you get that opportunity, you find difficulty in finding a job, because most of us, we do have the qualifications, but we're sitting on them. You end up doing something which is not really in your interest, just so you can get bread on the table. So that's the context that we were working within. So just to give you an overview very quickly of the goals and objectives of this research, although in the previous presentation you did get some idea of this. The primary goal was to identify and describe youth workforce programs within South Africa, particularly that would lead to careers within the health and social service sectors. Within this goal, we had secondary objectives, which were to identify and describe youth workforce programs that build more sort of general skills, leading to general employment opportunities, to examine the effectiveness of these youth workforce programs, particularly on employment, and also to look at the effectiveness of youth workforce programs on HIV risk, particularly among adolescent girls and young women. Okay, so a summary of the field work. The assessment involved in-depth interviews and focus group discussions, and this is undertaken by a 4-person mixed team with 2 representatives from FHI 360 and 2 from South Africa. These interviews took place in the Gauteng and Western Cape provinces, and they included over 25 interviews with stakeholders such as program managers, donors, academics, government officials, and employers. We also undertook focus group discussions and in-depth interviews with youth, with about over 50 young men and women who represented pockets of youth that were either unemployed or program participants or program alumni. So the programs that we looked at, so in total there were 25 in-depth interviews with stakeholders. Of the 25, 13 were programs specifically. And these 13 programs offered a variety of intervention, but they had a combination of the following. So many programs focused specifically on work readiness, which is where they provided training leading to careers, whether in the health and social service sectors or other specific sectors, or more sort of broad work readiness skills development. Some allowed for direct job placement opportunities, and this was through partnerships with industry and government, and some of these programs work closely with industry to identify need and demand and to be flexible in that way. Other programs more holistically focused on the individual and on soft skills development, things like leadership, mentorship, HIV/AIDS, computer literacy, gender-based violence, financial literacy, career guidance, and just general psychosocial support. And then some of the programs targeted youth at the high school level in terms of career guidance and career opportunities, knowledge around subject decisions, and particularly math and science tutoring for health and social service sectors. So none of the programs that we reviewed had any costs for youth to participate. Some offered stipends or travel allowances, and most of these programs required at least a matric for entry, which is the completion of high school. And this was a significant barrier that we picked up on. If youth did not have a matric, they would struggle to enter into workforce programs. So out of the 13 programs that we assessed, 3 were specifically focused on employment within the health and social sector. So the first was Pilo, and you will hear more detail about this in the following presentation from Lizette. But just to give you a brief overview, Pilo, it trains youth to be pharmacy assistants and serves 2 primary purposes. The first is that it provides careers for members of vulnerable families and communities, and it's estimated to generate about 75 million rand through salaries back into these communities. And secondly, it provides essential services to the health sector, then freeing up pharmacists for more higher level tasks. The second program was NSCCW. This program trains unemployed youth selected by their communities as child and youth care workers. And this has 2 outcomes. It allows youth to provide essential services that support vulnerable children and families within their own communities, while still being able to also enter a career within a recognized discipline. And then it subsequently is also a cost-effective means of meeting the growing demand for social services within South Africa. And then thirdly, we had Nakosa. Nakosa also provides child and youth care worker training, but they additionally work in the fields of social auxiliary workers who assist social workers, community health workers, home-based carers, and auxiliary nursing. And then, sorry, to move on. So with some of the other programs, while they weren't specifically focused on the health and social service sectors, they could be linked to them and did have some roles to play. So for example, we had a program Fit for Life, Fit for Work that placed many graduates at health centers. So even though they did more general skills training, many of these graduates were able to work at health centers that were connected to the program. A program such as Bridge to Employment, which had an training for high school graduates, and it was an emphasis on health career exposure and STEM subjects within high school. And then another program, MLab, where the youth participants developed and commercialized mobile apps that were tailored to health industry needs. Some evidence from the workforce programs. The programs that we reviewed, they did offer several benefits, including positive psychosocial impact, what we refer to as bankable benefits, which is practical skills training, soft skills, development, experience, mentorship, which would support youth in general. However, in terms of employment impact, these outcomes varied. I'll give you a couple of examples. One program had a placement rate of about 85%, although it was quite a small population group. 2 others between 40 to 50%. One program estimated to have created about 31 new jobs in their 2016 year, and 48% of these positions were filled by women. And this program estimated that their employed graduates increased their household income by about 250%. So these are all relatively strong outcomes. However, overall, while the positive psychosocial and skills development outcomes of the programs were clearly apparent, the evidence for direct impact on employment was slightly less so. And just to further support this, our assessment team, we spoke to stakeholders from the Centre for Social Development at the University of Johannesburg who had undertaken a youth asset study, and this study evaluated 8 workforce programs in 48 sites. It was a very similar study to ours, a lot more in-depth, and their results were similar. So they indicated positive psychosocial benefits, however, impact on employment was less clear. As I mentioned earlier, one of the secondary objectives of the assessment was to look at the effects of workforce programs on HIV risk and vulnerability. And the programs did indicate some effects, particularly in terms of risk behavior. And this is through soft skills and life skill development and mentorship. Just 2 examples from the youth who were program participants that we spoke to. A female youth said you need to put your foot down, that's when he takes you seriously, and this is talking about sexual behavior and how to be assertive when we're in relationships. A male youth said sexual reproductive health, the skills they gave me there I still use today. From your basic HIV, the understanding of HIV, where you get tested, the treatment of it, I learned a lot from that program. So there was some effect there. Quick overview of lessons from the programs that we looked at. So first is that programs with strong employer links we found to be the most successful in terms of placements. And these are programs that work closely with industry. The second was that there was a significant challenge in terms of program sustainability. So these are particularly for donor-funded programs. The assessment team learned of a number of donor-funded programs that were no longer operating or on the verge of closing down as a result of cuts in funding or shifts in funding or just a lack of funding. One program manager remarked that all roads to scalability lead to public financing. So this was a significant challenge and something that should be looked at. A third lesson was that challenges in ability of marginalized youth to access services and programs. So, for example, the limitation of matric requirements. In particular, rural youth and township communities were found to be underserved. So the issue of an urban and rural divide was mentioned. Many stressed that the level of opportunity and structural supports in rural education was severely limited, and this often puts youth at a disadvantage when attempting to enter tertiary education, find a job, or enter workforce programs. Programs were also found to reach young people a little too late, so we noted that there needs to be an improved high school development of career guidance, work experience opportunities, and also STEM subjects, math and science skills. There was a need for career accreditation, security, and progression. So this is noted particularly for volunteers. So we found that even when someone is hired, a career progression can be limited and can further dishearten youth. And within our focus group discussions that we did, particularly with unemployed youth raised how volunteer work may not be always recognized or accredited, and thus not allow for an advance in career strengthening. For example, one youth explained how he had trained as a volunteer care worker within an NGO, and he had acted as an HIV care and treatment counselor for several years. However, when the program ended, he had no evidence or accreditation of the training and work that he had undertaken. And he said you can't look for a job with an attendance certificate, which is all that he had. This was not sufficient. And another youth shared a similar experience, saying that when you say that you work for an NGO, they ask where is the proof, where is the certificate, and when the opportunity comes, you can't apply. So this was a particular lesson that we noted. And in closing, just to look at some potential solutions and opportunities. There's 6 that I'm going to touch on here. The first is that enhanced links to government, health and social service agencies and accreditation bodies would definitely strengthen workforce programs. And programs that we looked at that did this really well was Kids and Pilo, AICCW, and NACOSA, which are the programs I mentioned earlier. The second was to create new employer entrance exams or requirements to test potential rather than school learning. So as a result of South Africa's schooling system, employers were seen as being rather skeptical of the matric certificate, and as a result would often implement standardized entrance tests, and these are designed to test school learning in areas of acquired knowledge such as math, rather than maybe to test a broader concept of ability. And this could often hinder youth from more disadvantaged education backgrounds. So a program that we looked at called Harambee, they have developed a different set of tests that measure potential rather than school learning, and they have been really successful in getting some employers to start using these tests instead of the traditional tests, and this has broadened the scope for youth that can participate and benefit from these programs. The third is strengthening links to employers and industries. So this ensures that graduates from these programs and also from tertiary education as well, are meeting employer skill requirements. And it helps to overcome employer reservations to hire youth from more vulnerable communities with a weak school system. And this ties into the fourth opportunity, which was work experience. So this was, again, a significant issue. Even for youth that had tertiary education, they were still struggling. And so there's opportunity to incorporate this more into the high school and tertiary experience for youth. Enforce things like reference letters, portfolios, internships, learnerships, how to sort of incorporate this from an early age. And these can serve as substitutes for maybe prior experience and also a lack of social connections. The fifth opportunity or solution that we looked at was training on entrepreneurship. So this is particularly because employment opportunity and availability is not, they can't necessarily meet the growing demand. So this creates the ability to identify and access new sources of income in a context of limited wage employment opportunities. And many of the youth that we spoke to, they see entrepreneurship as a way to overcome some of the obstacles that we discussed. And several program managers mentioned that many of their program participants decide they do not want traditional employment and they want to rather set up their own businesses as they see this as more viable and sustainable. And finally, exposure to careers within the health and social services sector was seen as a significant opportunity and a need to increase this, to create more awareness and interest in jobs in these sectors and the types of jobs that are available. As mentioned before, often when speaking to youth would focus on jobs such as nursing or being a doctor, and the scope of jobs within these sectors wasn't always known. And this can also be transferred over to just.
And now we're fortunate to have Lizette Monteith, who is a National Pharmaceutical Services Manager from Keflin-Pila Pharmacist Assistant Program, a program that has been recognized globally for its innovation and success in helping marginalized youth secure employment as pharmacy assistants. Lizette was a key informer for the assessment team, facilitating a visit to the pharmacy at a local public health care facility and an on-site interview with youth participants.
Hello everybody, can you hear me? Okay, great. So basically, sorry, Rachel, are you driving the slides? I just want to double check. No, don't worry, I've got it. Yeah, okay. Great, so just as an overview, what I would like to focus on today and how I'm part of an NGO and we implementing, and the learnership was one of the programs, the pharmacist assistant learnership was one of the programs that we did. So in this presentation, I've got information about the pharmacist assistant learnership, but I've also added a little bit about what pharmacist assistants can actually do once they are qualified and employed in the primary healthcare sector, and the benefits of this as well. So we're going to look at some of the challenges in the pharmacy sector, pharmacy support personnel, the Keflin-Pila Pharmacist Assistant Training Program, like I said, accomplishments of the pharmacist assistants in primary healthcare, and then the recognition conclusion, and I've got some references in here. Just to note, what I have not got in this presentation is that Keflin-Pila have also been doing learnerships for social auxiliary workers, phlebotomists, and trains many community health workers, which are also mostly youth and mostly from marginalized communities. But for today, I'm going to focus on the pharmacy part of things. Okay, so just as a background information, South Africa has the highest burden of HIV globally, yet there's only one pharmacist per 3,837 population. That is 2.6 pharmacists per 10,000 population, and to give that some context, according to a 2015 WHO report, Africa as a region has only 0.8 pharmaceutical personnel per 10,000 population, and the next lowest region is Southeast Asia with 3.8 pharmaceutical personnel per 10,000 population. So we're lacking quite far behind in Africa. And this shortage of pharmacists is a critical limitation to providing antiretroviral treatment to those meeting the treatment criteria. And with a little bit over 3 million people currently on antiretroviral, another 3 million have to start treatment to meet the United Nations fast-track targets. And then just looking at this fast-track targets, the United Nations has set ambitious targets, treatment targets, that need to be reached by 2020, and South Africa has undersigned that. And to reiterate, by 2020, 90% of people living with HIV have to know their status. 90% of people diagnosed with HIV will receive antiretroviral therapy, and 90% of people receiving antiretroviral therapy must have viral suppression. So what are some of the challenges for the youth to find jobs in the healthcare sector? So firstly, most qualifications require interested candidates to have a high school graduate qualification, as you've heard from the other presentations as well. And this is part of the entry-level criteria for the learnership. Our education system are still very unequal in South Africa. So unfortunately, poorer people access poorer schools with poorer outcomes. Secondly, to obtain the correct qualification is challenging in an environment heavily regulated by law, with statutory councils governing minimum standards. Then also, once the correct qualification is obtained, the candidate must secure a job in an environment where not enough positions are created or available, and positions that have not been filled for 12 months are often frozen. Also, new qualifications are developed and people are trained, but the job specs and the positions are not yet created. Lastly, many healthcare positions, especially for mid and lower cadres of staff, are contract-based and depend on the availability of funding. So what can the pharmacist assistants do and support with in the primary healthcare settings? And to focus on this, I would like to just give a little bit of background. About 12 years ago, we at Ketinpilo realized that there's not enough pharmacists to do the work needed in the primary healthcare facilities. During this time, we started a pilot project in liaison with the Department of Health in the city of Cape Town to place qualified post-basic pharmacist assistants in primary healthcare facilities. The law in South Africa allows pharmacist assistants to work under the indirect supervision of a pharmacist in primary care settings with certain conditions. The Ketinpilo pharmacist at that point became roving designated supervisory pharmacist. And during this pilot stages, the pharmacist provided additional mentoring and support to the pharmacist assistants at a weekly basis, which included basic HIV training, pediatric training, drug supply chain management courses, and more on that line. In the primary healthcare sector, post-basics can take the responsibility for the management of medication, which includes ordering, receiving, and management of expired medication, or reduction to expired medication. They can dispense antiretroviral and TB medication to patients. They provide information to patients regarding their medication, how to store it, what side effects to expect, etc. They support good pharmacy practice compliance in medicine rooms and dispensaries. And they support differentiated models of medicine delivery like adherence clubs, the TCMDD program, and fast lanes. So with regards to the pharmacist assistant learnership or training, now you'll see that my numbers are slightly different as what some of the other presentations is, and that's because we were still training a class while we did that report, and that class is now finished, and those numbers I've added in the presentation. So currently we have no pharmacist assistants in training, but during the program we have completed training for 513. So part of the reason why we started the pharmacist assistant training is because during the time we did this pilot project and placed pharmacist assistants in primary healthcare facilities rather than pharmacists, we also realized that there's not enough pharmacist assistants. So to address this critical skill shortage in the pharmacy workforce, we embarked on a pharmacist assistant learnership program. 513 young South Africans, mostly from marginalized communities, earned a post-basic qualification in the 7 years that we've been actively training. We trained, as you can see on this map, in 5 provinces in South Africa: the Western Cape, Eastern Cape, KwaZulu-Natal, Mpumalanga, and the Free State. The majority of these learners that we've trained are now working for the Department of Health. And a prior study that is referenced at the end of this presentation shows that pharmacist assistants in primary healthcare facilities ensure better patient outcomes, improve stock management, and that is at half the cost of a professional nurse. So if we look at the entry-level criteria for pharmacist assistants, or entry-level salary for pharmacist assistants with a 2-year qualification in the Department of Health, these learners collectively, the 513 learners, collectively earn more than 100 million rand every year. That is more than $7 million US. These funds are used to support complete families. The total cost of the learnership during this time period is approximately 71 million rand, which gives a return on investment of 222%. Imagine projecting the earnings over 30 to 40 years. These results also show a positive impact on unemployment and, at cheaper than nurses, yielding higher quality of care in the pharmacy sector. The candidates are also recruited within their own communities as far as possible, therefore giving them a way to sustain themselves and their families while supporting local primary healthcare facilities. So just looking at the method of the learnership program that we use. So we looked at the 3-step selection criteria during the recruitment process. So firstly, we would identify high school graduates with mathematics and English from CVs that we receive. Advertisements are placed on social media as well as in local clinics to improve the chances to attract people from the communities. Secondly, we invite all the eligible candidates for a pre-selection test to screen for basic mathematics skills and English comprehension. And lastly, the candidates who pass the pre-selection test are interviewed. Successful candidates are then registered with an accredited service provider and with the South African Pharmacy Council. They're placed in Department of Health facilities and linked to a Department of Health pharmacist who acts as tutor. Learners support the facilities from day one of the training due to the in-service nature of the training. They spend 4 days a week in the facility and 1 day a week in a classroom training with a facilitator. Learners receive a monthly stipend to support transport costs, and we have continuous communication throughout the training with stakeholders to motivate for the creation of positions for these learners once they qualify. And just to mention, in one area of KwaZulu-Natal where we trained, the whole class was absorbed into the DOH. They created positions for every single one of the learners. Not always the case, but sometimes it works out very well.